I found out that I had breast cancer. And at that point, everything stops momentarily. You start to think, what is next? What can I do? How do I stay healthy? How do I stay alive? How do I fight breast cancer? After 6 aggressive rounds of chemo, I had a complete pathological response to the treatment. But still, I was really concerned. I wanted to make sure that I was doing everything possible to be around for my husband, my siblings, my family, my friends. I learned about Nerlynx as an option for me after talking to my oncologist and asking her, what else can we do? What's next? I took the time to research the information. I took the time to lean into the science to figure out what would be best for me, and that was Nerlynx. My doctor told me that I needed to take the medication for a year and that I needed to take it every day, and that I needed to make sure that I was taking it at the same time every day. So I made a point to follow those directions to the T. I then had to talk to my husband and my family to tell them, this is the next phase. And everybody wanted to understand, why are you going to take another medication if you're done with your core treatments? And I explained to them that this medication, would help me to reduce the chance of recurrence. And they all got that. And they said, Sherry, you have to do whatever you can to live a healthy life.
What is Nerlynx, neratinib tablets? Nerlynx is a prescription medicine used alone to treat adults with early-stage human epidermal growth factor receptor 2, HER2, positive breast cancer, and who have previously been treated with trastuzumab-based therapy. Nerlynx is also used with a medicine called capecitabine to treat adults with HER2-positive breast cancer that has spread to other parts of the body, metastatic, and who have received 2 or more anti-HER2 therapy medicines for metastatic breast cancer. It is not known if Nerlynx is safe and effective in children. Important safety information. Diarrhea. Diarrhea is a common side effect of Nerlynx, but it can also be severe. Diarrhea may lead to loss of too much body salts and fluid, which can cause dehydration. Your healthcare provider will prescribe Nerlynx in one of 2 ways to help manage diarrhea. Full dose of Nerlynx. Your healthcare provider will prescribe the antidiarrheal medicine loperamide for you during your first 2 months, 56 days, of treatment with Nerlynx and then as needed. A lower starting dose of Nerlynx. Your healthcare provider will start you on a lower dose of Nerlynx for the first 2 weeks of treatment and then increase you to a full dose Nerlynx regimen. Tell your healthcare provider right away if you develop diarrhea. You may be prescribed loperamide as needed. Always take antidiarrheals exactly as your healthcare provider tells you. Call your healthcare provider right away if you have severe diarrhea or if you have diarrhea along with weakness, dizziness, or fever. Your healthcare provider may change your dose of Nerlynx, temporarily stop, or completely stop Nerlynx if needed to manage your diarrhea. Liver problems. Tell your healthcare provider if you have liver problems. Changes in liver function tests are common with Nerlynx. Your healthcare provider should do blood tests before and during treatment with Nerlynx. Your healthcare provider will stop your treatment if your liver tests show severe problems. Call your healthcare provider right away if you experience tiredness, nausea, vomiting, pain in the right upper stomach area, abdomen, fever, rash, itching, yellowing of your skin or whites of your eyes. Pregnancy. Nerlynx can harm your unborn baby. Female patients should tell their healthcare providers if they are pregnant or plan to become pregnant. They should use effective birth control, contraception, during treatment and for at least 1 month after their last dose of Nerlynx. Male patients with female partners who can become pregnant should use effective birth control during treatment and for 3 months after the last dose of Nerlynx. Breastfeeding. Tell your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if Nerlynx passes into your breast milk. Do not breastfeed during treatment and for at least 1 month after your last dose of Nerlynx. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take medicines used to decrease stomach acid called proton pump inhibitors, PPIs. You should avoid taking these medicines during treatment with Nerlynx. You should avoid eating products that contain grapefruit during treatment with Nerlynx. The most common side effects of Nerlynx when used alone include diarrhea, nausea, stomach area, abdomen, pain, tiredness, vomiting, rash, dry or inflamed mouth or mouth sores, decreased appetite, muscle spasms, upset stomach, nail problems including color change, dry skin, swelling of your stomach area, nosebleed, weight loss, urinary tract infection. The most common side effects of Nerlynx when used with capecitabine include diarrhea, nausea, vomiting, decreased appetite, constipation, tiredness, weakness, weight loss, dizziness, back pain, joint pain, urinary tract infection, upper respiratory tract infection, swelling of your stomach area, kidney problems, muscle spasms. These are not all of the possible side effects of Nerlynx. For more information, ask your healthcare provider. Tell your doctor if you have any side effects that bother you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.